Vijay Bhaskar Bandikatla is a luminary in pain medicine and the top pain physician in Hyderabad with 20 years of immense experience. His remarkable journey in the field of medical innovation has earned him widespread recognition and accolades from esteemed national and international organizations. His unparalleled expertise in pain medicine, neuromodulation, and groundbreaking research in spinal cord stimulation has not only transformed the landscape of healthcare but has also inspired peers and patients alike. Hello, Dr. Vijay. It's a pleasure having you with us today on the occasion of International Doctors' Day. So, while we know that you are a renowned pain physician in Hyderabad, we would like to know a bit about your background and how you became interested in pain medicine.
Thank you very much, Vinilagar. So, first of all, pain is a very interesting specialty. Unlike other specializations that you see, a cardiologist is there for treating the heart, an orthopedic surgeon is treating a bone. Similarly, various specialties. Most of them are organ specific specialties, as opposed to pain, which is a symptom specific specialty. And because of the same reason, it has not been given very much importance across. So, everyone is expected to treat pain. Doctors are expected to treat pain of the patient when they come into the hospital, but unfortunately that's not how it works, and they don't get a complete and comprehensive way of managing patient's pain, be it an orthopedic bone related pain or a cardiac pain or an abdominal pain. So patients come with various pains, but then the doctor as a specialist, they would be identifying the symptoms related to the patient's condition. For example, if there is a stomach ache, so they try to find out what is the root cause of the stomach ache and try to treat the root cause, but in the meanwhile they'll ignore the symptom of pain. That is exactly what the suffering which brought the patient to the hospital in the first place. So there is a gap in the management of pain of patients. So the doctors are actually not geared up because they are not trained in treating pain to after certain degree. Simple painkillers, most of the people will write. But then when it comes to management of pain in complex situations, there is a huge gap, and that is exactly the gap which we try to address. So when you treat the pain, so you basically have various modalities. There are lots of different varieties of medications, some very simple, some can be complex, lots of different therapies, some very simple, some complex therapies, lots of interventions, and sometimes you might require a surgery to relieve the pain. So what is to be done at what point, that is where we come to discuss with the patients and do the needful to the patients. That is where the pain specialization comes.
That's very interesting to know, sir. I think in India, people are used to living with chronic pain. I mean, daily, for example, if we take a housewife, if she has a back pain, I think she's used to living with it for years. But I think rather than living with it, it's better to consult a pain specialist like you who has a lot of experience in this field.
Absolutely. There is nothing like no pain, no gain.
Exactly.
Right?
Yeah.
When it comes to complex and chronic pains, there are no medals that you get by suffering. Rather, you would actually go down with your life as you're suffering in pain. I'll tell you a small example. If you have a bad back pain or a knee pain, and that's what you see very commonly. So once you get a back pain, suddenly you would start to think, what have I done wrong?
Exactly.
That's the first stage. Then you would be starting to worry, how would I go to work tomorrow morning? And if it goes on for a week, then you would already be worried about it. Your workplace would be worried. Your life will start to go down. This is exactly the problem where not just the physical component, but the psychological component will start to work. And then the emotional component. You can't attend your functions, your parties, whatever you normally would like to do, you're unable to go there. So that's the next phase. And then you will start to get a financial hit. You'll start to lose your job and all these kind of things happen. So there's a lot of different things which will go around, and that will also have a huge impact on a person. So this is what we have to address when you are treating pain. So it is not biological, it is psychological, it is social, it is emotional, it is financial, and sometimes it is also quite spiritual. You will start to think, why me?
Exactly.
A patient who is suffering from cancer will also start to think, why me? Why should I endure this pain? I've done good things for so many people. All my life I've not done a mistake. Now why am I suffering in pain? So basically the suffering is actually equated to the sins that we have done, and that's what people would relate to, but that's not exactly true all the time. So that is exactly what we talk about, suffering of pain. So the pain is not exactly the sin that you've committed. So you should reach out to the doctor, get the treatment, get the pain out of the way, get your life in balance again. So this is very, very important, not just for the things that I mentioned, but also once your pain is controlled, your movement, your activities, everything will be better. Once you have a better activity levels, now your health will also be improved. You will eat better, you will drink better, you will sleep better, and overall well-being of the patient is significantly improved. This is exactly what people have to understand, and just don't keep taking pain. By just taking it, you will lie down in the bed, you will keep on doing things which are unnecessary, and then you will destroy your health and life.
Exactly. So, based on our research, so we found out that you have worked extensively in London and carried out a lot of research. So, what made you come back to India? And you have also founded the very famous Indo-British Advanced Pain Clinic. So, what made you return back to your home country and start your research and treatment of patients?
The idea was always to come back.
Okay.
The idea was always to come back, and I was always thinking about what is new that I can bring back. Anyway, I've studied here, I grew up here, and then all my career, my friends, my family, and my culture, everything is here for me. So I was there for a specific purpose, to learn, work, gain some experience, and bring it back to my mother country. That was always on cards. So I tried even before coming here. So I tried to come a little earlier, and then I had to go back, and again I have come back because I really wanted. So that's the first thing. Family is the biggest pull. So why I did pain is the next thing. You see, pain is one thing which will bring patients to the hospitals, get them to do all the investigations, and that pain, when you reduce, that's the bond between a doctor and a patient. So that's exactly, if you look at the statistics, WHO statistics, almost like 70% of all attendances to the hospital are because of pain. That is why all the surgeries, all the medicines, all the investigations for that matter, they happen. So relieving pain becomes the primary role of the doctor. But sometimes that relieving pain doesn't happen because either the doctors are not trained well, or maybe it's not given enough importance during medical training. Unfortunately, this is true. So there is a specialization which has developed into pain, and that's something which I realized while I was there in the UK. And they've got a very good structured training. While doing anesthesia, they've offered me that post. I said, I jumped and took it, because that gives me that compassion, that I can, the time that I can spend with my patient, understand their patient's problems, and I can provide some solutions which no one else will be able to provide, and I can put all my specialized skills. For example, my skills of talking to the patient, having their feeling known, and then my knowledge of physiology, the pharmacology, the knowledge about anatomy that I learn, and I can find out individual nerves. I do ultrasounds and the X-ray guidance and identify and treat those pain causes. So most of the times we'll be able to relieve those and relieve the pain. So all these kind of things, they made me interested into pain. But then I wanted to do something more different, something which could be very helpful for the long term. So after I completed my pain training at Cambridge Hospital, I went to London to do my fellowship in neuromodulation. Neuromodulation is like you use some electricity to alter the nerves, or you use certain chemicals to alter the functioning of the pain producing nerves. So once the pain is there, the nerves get sensitized, and you can actually bring it back to normal level by using certain techniques. So these are the techniques that I learnt while we were there at Guy's and St. Thomas's Hospital in London. So this gave me a lot of base knowledge, and my research was again on the same. So we did for chronic and refractory headaches. You would have heard about these migraines.
Migraines, yeah.
There are some very difficult headaches called cluster headaches.
Okay.
People even commit suicides for that.
Okay.
So those kind of headaches, they'll not be getting better with your simple medications, or most of the time the diagnosis itself might be wrong. So I worked with the headache unit, and then we devised these new treatment techniques where you put some electrodes onto the nerves that are reaching the head, and you can stimulate those. By stimulating that, the brain functioning will be altered and your headache will be controlled. These kind of things are called occipital nerve stimulation, supraorbital stimulation. All these nerves which are going can be stimulated. So that's my research which I submitted. Similarly, there is another research which I participated for failed back surgeries, or
Okay.
people who have refractory back pain. No treatment is working for them. All your medicines, your injections, your therapies, whatever you do, nothing is helping. They can't even sit. Then what would you do? That is when the newer technologies are coming. It's like a pacemaker. You have a wire which goes to the heart, which will control the way the heart is working, correct?
Yes.
In a rhythm disturbance that you get, when you stimulate these nerves, your heart functioning can be changed. Similarly, the nerves which are going down into your body, if they are hypersensitive, they are overactive, are working haphazardly, you can control them by putting an electrode into your spine and then connecting it to an external battery, very similar to a pacemaker. You put a battery, and that when stimulated, you can control pain. It looks very interesting. So
Exactly.
I gave up a complete year to learn it,
That's really
and
great.
then I practiced. So I worked as a consultant for 5 years after learning all of this. In total, lived about 14 to 15 years in the UK. I come back to India and started the Indo-British Advanced Pain Clinic, and the journey has been fantastic.
Absolutely, sir. So when we deep dive into your research, so we have also found out that you have done a lot on stem cell therapy and PRP and all that. So because you have done such intensive, research into this niche field, which is the pain management, and you have also won a lot of accolades and awards, and recently you have been conferred with the best pain physician in the state. So how do all these awards and accolades endo your responsibility further in treating patients? So how do you feel it as a responsibility or a burden, or how do you take all that pressure of living up to the best and giving the best for your patients?
Most important thing is when you are in a new specialization, so you are in a specialty where there's no one else, so very few people are actually practicing pain medicine across India. In other Western countries, pain is a very established specialty. There is a structured training to it, and the doctors who come, they've got a certain standard. Unfortunately, we are lagging behind. So I've got certain degrees, certifications, qualifications that I'm bringing along, and my experience that I've acquired overseas. So I'm bringing that. So that is my responsibility to build the standards, set the standards here, so that future doctors who are willing to take up pain medicine, they should live up to that standards so that patients get the best care. So that is my motto when I'm trying to work here every single day. So by doing that, in India, there are multiple specializations for pain. Right now, pain is such a vast subject, even in other countries, as you are mentioning. So there is something called headache specialists. So that is a pain specialization. Back pain, we discussed, very complex. People have back pain. Some don't want to have surgery. Some already had surgeries out of desperation, and the pain has come back. And it's very complex to treat those. So you need specializations. You have pain specialists only doing that. And you have pelvic pain. Ladies, they can't even tell outside that they've got that kind of a pelvic pain. They feel embarrassed to do that. So those kind of patients also need a specialist. So that is pelvic pain specialist. So we are working on that. So that is a specialization. Cancer pain is a complete specialization on its own. So as time goes by, every field in pain medicine is an individual specialization. It's like previously you had a general physician, Now you have a cardiologist, you have a neurologist, you have a nephrologist and a rheumatologist. You have a subspecialization into each of these. So that is how pain is going to become in future. So it's such a vast subject. So you have to put in a lot of effort to work on it. So another part of it is sports medicine and the pain which comes from the sports injuries. It will just destroy the career of a sports person, or maybe he is so scared to go out and express himself because what if I get injured, my career is over. Now we are in a position to deliver so many treatments to them, and what you mentioned is stem cells is one. Right. So we are very fortunate. We started off with a very simple PRP kind of treatments. Now everyone, so many people would have heard about platelet rich plasma, PRP. But we at Indo-British Advanced Pain Clinic, we advanced so many things. Now we are using the most advanced, the third generation plasma therapy, which is PRF, platelet rich fibrin. So it's an advancement. So it has got much more capacity to heal, and then to regenerate we have stem cell therapies. So it's a rapidly advancing field as regenerative medicine, where the stem cells previously they were taking from, you would have heard, like umbilical cord. The stem cells come from the umbilical cord, that you would have heard.
Yes.
Patients take out from the bone marrow, that you would have heard. But now we are kind of going into the finer understanding about the stem cell therapies. Say for example, at Indo-British what we do, if you have a problem in your joint pain or a muscle, the closest stem cell which is present in our body is present in the fat. So we take the fat stem cells taken from the fat which is lying unused in the body or excess and no one wants it. But then it is so effective, so you've got stem cells into it. We isolate these stem cells and then these stem cells are given back to the patient and then they'll help to heal. So that is done for the joints, for the muscles and so many areas. So the field is so rapidly advancing, you don't want to take it from your own body, but you can still take it from other people. And that can also be given from healthy volunteers. You can give it to the patients and help them. So the field is rapidly advancing. So it is our responsibility to keep up to date with all of these new advances. And we are very fortunate here at Indo-British Advanced Pain Clinic that we get all the best which is available in the world. They are actually coming to us because we are such a big market in India and we've got the specialized skills here. So they are coming to us to research. Currently we are researching on virtual reality. That is another very exciting field that we are working on now.
Absolutely.
So virtual reality, you are seeing it in your media business, in so many, all the kind of movies. You're actually seeing all the animations and everything. You would have seen all these motion tracking and all this kind of thing. That has come into medicine, and we are very, very fortunate. We are one of the pioneers who are working on that at our clinic right now, and that will come out into general public very shortly as well.
That's really great to hear, sir. And one more thing, which is a very sensitive topic in India, is that, whenever we hear somebody has a pain, they just get a surgery done. So, but later, as you said, they again suffer because of pain post-surgery also. So, many doctors also just perform surgery for the sake of it, or like you said, maybe they don't have that, specialization like you have mentioned. So, what's your take on this topic? How should people just avoid getting unnecessary surgeries done?
First thing is, you have to understand that, I'll give you an example for back pain. About 98% of back pains, they just don't need surgery. It's irony that so many people are offered surgery in desperation. Most of the times the patient feels pressurized because they don't have a choice and then they'll go for the surgery. Or the doctor himself, he's not aware of and not skilled enough to treat that patient's pain without surgery. So you would have seen quite a lot of pain gets better without doing anything, and that happens with simple muscle aches and pains which happen. Some of the patients, in spite of all the rest they take, in spite of all the stretching they do, the pain doesn't get better. They probably will go and take a medicine. End of the street, they go to the pharmacy. Sometimes it can be dangerous, but they still take it. Not getting better, what would you do? He probably will try to reach out to a physiotherapist. These days, people talking about chiropractors. So all these kind of things which people attempt to do, not getting better, they themselves go and get an MRI scan these days to see. I don't know why they get it done like that, or they go to a neurosurgeon or a spine surgeon to check it out. Spine surgeon will see a disc. Oh, what do we do now? You have a small disc. Shall we give some medicine, or maybe I'll give some injection? You go away, didn't get better. Oh, let's do the surgery. What surgery you do? You actually open up the spine, you take out the disc, you put rods and screws, you fix it. And you have to understand, the spine is meant to be moving. That is how you get all the balance.
Exactly.
Right?
Yeah.
You have to have an absolute balance when you have to move. Once you take out parts of that spine or fix parts of the spine, how are you going to get that balance? Your muscles are taken out, your bones are chipped away, and you are fixed. Now you have a bigger problem, right? You're actually making it worse. So it's very specific when you should do surgeries. Only when you have a muscle weakness or a pain which is tried in all different directions and you can't help it. Are patients who are developing problems with bowel and bladder control, that's called cauda. Only some specific conditions you should go for surgery. Otherwise, we want patients not to go for it, because all surgeries, they come with a morbidity, which is a complication is there anyway with the surgery. You can get an infection, you can get a nerve damage, you may not be able to do the things that you are doing right now. So unless you are able to make it better than what it was before, don't go for surgery. So we are very clear with that, and we tell the patients, we reassure the patient, sometimes we may not be able to help to the full extent. Your pain might be partially helpful by the treatments that I am offering you, but still surgery might not be the best option for them. So they have to weigh these two things before they take the call for a surgery, and we try to educate the patient on these. And that's the reason why we are not the darlings in the hospital, right?
Makes sense, yeah.
Yeah. So this is our responsibility as pain doctors. So we really have to go out with a great confidence. We have to impart that confidence to the patient as well, that it's okay, you have a disc, but it can be treated. It may not get completely normal, but you will have a normal life. So this is what I tell my patients always. Don't worry, you will be absolutely fine. For example, I myself have got operable discs, so to say, but I don't need an operation. 25-30 years I've been managing both in my lumbar spine and my neck. So you can lead a normal life. I do everything. I play, I jump, I lift weights. You can have a normal life. So just be aware, take a second opinion before you go for a surgery. Same thing with knees. Originally the knee replacement was designed for very bad knees, people who are unable to walk. Now slowly, as you say, there is no other treatment. You started bringing the bar down. Now even little stage 3 arthritis, what we call mid-level arthritis, you say anyway it is going to get damaged, get the surgery done now. No, we have all the regenerative therapies. You regenerate the joint, make it better. Repair is always better than replacement. So you do the repair of the joint, you regenerate the joint, you get it back into condition, and then use it better. And that's the treatment.
That's very inspiring, sir. And one more thing, you must have treated like thousands of patients in your career. So can you please share one memorable incident with us, which you thought wherein the patient, was suffering a lot, and then he or she consulted a lot of other doctors, but didn't get any respite, and then they came to you, and then they got their life back to normalcy. So can you please share one incident?
Many of those incidences in the hospital, because patients I get at the pain clinic, they would have gone through the revolving door. They would have gone to multiple hospitals, consultation with multiple doctors, lots of investigations. When everything else fails, someone will tell me, go and see Vijay. And that's how most of the patients come to me. So most of the times you can do certain things to completely transform their life. Many patients. So I've got lots of testimonials in those directions. But I'll tell you maybe one or two instances where these kind of things happen. For example, I had a patient who had multiple myeloma. Multiple myeloma is a bone cancer.
Okay.
Blood cancer spreading into the bone. So this patient had severe pain all over her spine to the point that she can't even take a breath. So she was at home, she was in her mid 60s, can't even take a breath. So to facilitate her breathing, they put her on a face mask, got a hospital bed at home, and then she's being nursed at home because it was COVID. They didn't want to go to the hospital.
Yeah.
And she exhausted all the treatments, all the chemotherapies, radiations, whatever is. She exhausted everything. And they were like, hands up. The whole family was like, she was in so much of pain. At least we know she's dying in maybe less than a month or so. But we want her to go peacefully. And that's the only wish of the husband, only wish of the family, the daughters and the entire family. So when you see that patient, you will start to feel very sad. I said, is there anything that we can do? Yes, a lot. So we went, and then I assessed her oxygen levels were about 70 or so. She was struggling with that face mask to put it on even for 24 hours a day. So we've treated her pain, did an injection to the spine, so put a catheter and ran an infusion. That relieved her pain significantly. About 75 to 80% pain has gone down. Only pain which was left was around the shoulder. So the rest of the lower half of the body, which was her worst pain, was gone, and she was happy. But then the only complaint she continued to have was, my shoulder pain was hurting. Can you do something about it? And at one point she wanted to take out the infusion because it's not helping her shoulder. What's the use? It's still hurting. So we changed certain things and explained it to her. So ultimately we had to stop and restart because she faced actually what the lower half pain was. Once that whole thing happened, she slowly started to remove the face mask. That's exactly what I told her. Second time when I saw her, I told her, look, where is your mask now? Your oxygen levels are maintained because your pain is relieved. She's breathing better. She didn't need the mask any longer. So slowly started transforming her life. And patient didn't even realize because she's only focused on the shoulder pain. So once she realized, actually my life has changed. So slowly she started eating better. She started coming out to the front room, walking around the house with a stick or a walker. Slowly she's sitting in the front room, the lounge, watching the television and things like, spending time with the family. Mind you, not less than a month, she lived for more than 6 to 9 months without any further aggressive chemotherapy, no radiation, nothing. She was not even going to the hospital. All we were doing was changing the drug bag. And she lived so long. And that's the transforming thing for her family.
Absolutely.
And I tell you a little thing which I learned to the end of her life. Ultimately, the life ends at some point due to cancer. All we can do is make it comfortable as long as we can. At some point, as she was living, her life started to deteriorate because of the cancer itself. At some point, cancer is also catching up. It's a fight between her life and the cancer.
Yeah.
But the pain was there, springing in between, making her life worse, making her life worthless. So when we take the pain away, she had the courage to fight. She fought for about 9 months. Towards the end of the life, when the pain started getting worse, or maybe she's living longer, the family issues started to creep up. The husband was getting a bit uncomfortable. They didn't expect this long. So there are lots of different family dynamics which go on. So they needed a lot of support. He was feeling like, I'm putting pressure on the family. My wife is putting pressure on the family. So all these things will have a lot of issues which will go on around the family. And as doctors, we are very aware of, or maybe very conscious about how to deal with these little things which go on, and support the husband, support the patient herself, and the larger family. And it's a very difficult but very rewarding journey for me as a pain doctor always.
That's very inspiring, sir. So, like you mentioned, the pain management practices in India might be a little, subpar when compared to the global standards. So where do you think India is ranked in currently, and how can it get better in the future?
India, we have huge amount of manpower. We have good resources, very intelligent people all around. So as of now, the training is subpar. We don't have enough courses there. We don't have enough trainers there who can train the junior level doctors who are coming up. You need lots of training to bring it to that level. So there is a lacuna there. So that is something that we have to build up. The capacities should be built up. So once the COVID is done, once the clinic has picked up, and now I have 3 doctors along with me who are getting trained, and they are treating patients now. They've got enough training now. So we are setting the standards. So they get trained in what we talked about, regenerative therapy, the spinal non-surgical way of treating the spine, knees, neck pain, all the headaches, pelvic pain, lots of different specializations. They're going into each one of them and getting expertise on that. So we are taking them to various different courses, conferences, and then building up their skills. So we give them certification, and hopefully we're waiting for the state government to give us some permission to train these doctors. So if we get that permission, we can train future doctors, and that is a responsibility that we are very much willing to accept, provided we are allowed to take it. So we have all the skill and expertise. I have been a trainer in other countries. So if I am given a role, we will just definitely give them that qualification as well from the government, approved qualification. With that, we can build that skills. So once a skill set is built, once the standards are set, so these next level doctors, they will also go into the community and they will practice at that level. In every town or every smaller place, you will have specialized doctors who are delivering those services, and that's how the skills have to be built at that level. And from this side, the latest advances which are there across the world, we are almost the first people who are getting them now. For example, the virtual reality I mentioned, the company has approached us from US. We've got a tie-up with them. So we are actually doing research in collaboration with Oxford University and Exeter University from an American company. So we are all collaborating to get this virtual reality for management of pain. Very interestingly, your brain can be distracted by this virtual reality, and we can make you distracted from pain or forget your pain. And we have got lots of techniques like mindfulness. So you are aware and very consciously you kind of keep the thoughts of pain away, because your brain is such a wonderful thing. It can do lots of things, and it can heal your pain, it can heal your suffering. So in spite of having the loss of your loved one, you will get over it after some time. So how do you do that? The brain's power. So we are leveraging that power to make it better. So that's what we're trying to do. So that is there, and you can do lots of education. And now we are doing lots of assessment of pain, assessment of your movement. For example, how much your neck moves. Right now the doctor just writes movement is reduced by how much. So with advanced technology, we are able to calculate by how much. So we're going to bring it into medical practice. All these kind of things, it's very exciting. Pain is going to be very exciting for future. And I'm very, very happy to be in this kind of a space in India right now, where there is a lot of scope to develop it. So I'm very happy for the pain specialization in India.
And I think patients are also equally fortunate to have you here, sir. But one doubt is that, you might be having a lot of patients from the rural areas. They
Yes.
might not be having, that level of education or knowledge to understand all these advanced practices. So how do you convince them to get treated, away from the normal conventional ways that are being used? So they might be, a bit reluctant at some times, or, they might also be refusing treatment. So in order for them to opt for this advanced treatments, so how do you convince them, or how do you talk to them in such a way?
It's a very, very interesting question. And this was my biggest doubt when I was coming to India, honestly. So how do I convince these people that these treatment work for them? How do I convince them that you don't need a surgery? Because that's what everyone thinks. Oh, I've got a neck pain, I've got a knee pain, I've got a back pain, so go and get a surgery. I know I've seen quite a lot of people who had this surgery fail. For example, I'll tell you, out of every 10, at least about 3 of the back pain patients, they will continue to have back pain after surgery. It's a sad state, but that's how the body works. It's not the fault of the surgeon or the patient. It's just the human body. You fix it, the pain comes back. So patients didn't have a choice these days, all these days. So now we are coming up with a new treatment plan, treatment protocols. So how you can manage this pain, not just one thing, but you've got a set of things that I'm putting in front of the patient. So I'm going media like you, print medias, and various other camps, conferences, courses that we are conducting. We are approaching to the patient straight away. We're telling them that, look, you actually don't need a surgery for this. And then once I started treating some number of patients, those patients, they've gone back to the community, they are bringing in, they come along with the patients to my clinic. They said, I've gone better, so you better have it, this treatment from this doctor. So they give testimonials, and the patient testimonial which I get, so that is value more than gold. So that if I put it out on any of these social medias, so that is attracting more patients. And that's how it's a word of mouth which is spreading. And then we have plenty of patients. We have already done some thousands of patients, more than 25,000 procedures we've conducted, maybe 40,000 procedures now we've conducted so far for all patients very successfully, and the results are there, and the patients are bringing more patients, and that's how we're just reaching out to patient. And now you can see there is pain as a specialty is accepted across the community. There are lots of other pain doctors, irrespective of their training level, they're bold enough to start the pain clinics, and then patients are also going to those local clinics, and that is a success, that society is accepting pain as a specialization. I'm very happy about that. And we have to do a lot more to build that awareness. Hospitals, big corporate hospitals, government hospitals, they have to do their bit to develop pain as a specialty now. So from the outside the community, awareness, patients are ready, but this society should offer them the treatment as well, the corporates, the government. Until now, pain specialists, they're not fully recognized as a specialist. The problems on both sides, I agree, but that has to happen from the government as well. In terms of reimbursements, insurances, and all these kind of things, they are not still available. If you don't do a big procedure, the hospital doesn't get money. Exactly. If you prevent a surgery, the hospital loses money. So it's the hospital's problem as well. The society has to address that problem. If I prevent you from having a major catastrophe, the hospital is disincentivized. So that's a problem that we have to address. Only we are paid for procedures, and then everything goes towards a surgery. So there are so many problems and loopholes that are to be fixed for the patient to get that best service, and we are all working for that. And this is one big chunk which will fit in the middle to avoid those number of surgeries.
Absolutely, sir. So as you said, even the doctors should step up, and the government as well. So what do you think, the whole health ecosystem can do to better the patient care and outcome in this niche field of pain management? Because especially in a country like India, as you have mentioned, there are many people who are hesitant to just come out and express that they have pain. So how can we work towards, bettering the patient care and outcome?
So the problem is multi-layered. It's always like that. So historically, India has been an underdeveloped or a developing country. So for us, having access to a doctor itself was a difficult problem, right? At that point, the basic specializations like gynecology, maybe a pediatrician or a general surgeon or a general physician itself was a big thing for us. When we were growing, that's having a general physician in a district level was a huge thing. But slowly the specializations evolved, our paying capacity has increased, and as the specializations came, so you will see more super specialists like cardiologists, neurologists, or maybe surgeons, neurosurgeons, all these individual doctors have come up. But then the burden of the disease is so much, each of these doctors, they had to do lots of surgeries, they had to do lots of admissions. So that's how their practice was filled up with. So there is no specific focus on things that are more preventive. Historically, there is no payment, there is no structure to prevent diseases from happening. So that kind of preventive healthcare has not evolved. The primary prevention is something which will prevent you from having a disease in the first place. The secondary prevention is something what we are doing, like preventing the further progression of the diseases and avoiding major surgery, major treatments. So that kind of prevention is what we are also looking at. So these kind of things are slowly coming up, and that is a process that we are going through, and I am hopeful that in future this thing will happen. But as I told you, the government will also have to step up to encourage people who are preventing diseases. Now we are seeing these lifestyle diseases and treatment for the lifestyle diseases. So they are there, which is a welcome sign for the society that we are doing, and we are protecting the health of the people, not just firefighting things. When the thing happens, you go do the surgery, you get better. So those days are gone now. If you look at a Western country, the number of spine surgeries that happen, the number of knee replacements that happen are very small. But in India, that's the only thing which is available to the patient. And that's what is being sold to the patient, that you have not got any other option. So you just have to accept it. So they take it in desperation. So slowly this awareness has come. Few weeks ago, a famous orthopedic surgeon has come out onto the public telling that don't take PRP. With folded hands, he is asking, don't go for all these treatments. So that's the level of understanding that the society has, and even among the doctors they've got that. But gradually, truth is always truth. Whatever regenerative therapies are there, they're all evidenced. You've got a lot of research backing it. One person cannot come and use his influence to say no, and I'll do only the knee surgeries, otherwise you don't get anything. You just suffer in pain. We can't do that. We have the responsibility to control the pain of the patient. May not be with the surgery, may not be with the physiotherapy. We'll do the best to improve that condition. May not be helpful all the times, but majority are getting helped, and that is the success that we get. And that's how the medical specialty evolves. When the heart surgeries were being performed, stents came. When the stents are being given, everyone questioned, why stents? Easy to do a heart surgery. When an open abdominal procedures were done, laparoscopy came. Everyone was questioning, why laparoscopy? You do it open, quick, done. Now laparoscopy is a norm for most of the surgeries. Now when laparoscopy has become a norm, robotic surgery has come. All laparoscopic surgeons are questioning, laparoscopy, I'll just do it fraction of time. Now robotic surgery has got a big role in medicine. They're doing it in abdomen, they're doing for gynecological, chest wall surgeries. So many surgeries are done with robots. Even for replacements, they're talking about robotic surgery, which is open, but still they are using robotics. So technology advances, we are embracing the technology and making it better. So that's how patients get the best deal. From us as doctors, we should be embracing the technology, see what best and where we can use it to the best of the abilities. And that's what we've been doing. And now we are very glad that all orthopedic surgeons, they are accepting it now, and they are using all these advanced therapies. They are at least opening up for it. So we are advancing to the next level, like from a PRP, when everyone is using, the technology has advanced to PRF, and we are using stem cells and various kinds of stem cells. We've got ablations, and then in that you have cooled ablation which is coming up now, cryotherapies which are coming. Lots of different new technologies are evolving, and we are at the forefront to do the best to the patient, and that's what medicine moves on.
So finally, what advice would you give chronic patients in India on how to approach the right pain specialist like you to advocate for their own health?
It's always difficult to find the right specialist in India because there's no standardization in your training, there's no standardization in your certification. How would you say a doctor who is coming from AIMS, how would you differentiate from someone who has done a 3-day fellowship or a 3-month fellowship in a surgery and then doing the surgery? Both of them will have some kind of degrees attached to them. So patients should be very well aware of these things and then identify the right person. But I've recently found out from the government, they actually said people should not, a doctor should not add these unapproved degrees next to their names, and they only confuse patients. So at least the government is starting to crack down on all these fellowships, FFF things which are getting added on to the patients, the doctor's degrees, which will confuse. So that is a step in the right direction from the government. And most of the patients, they just go by the word of the mouth and then go. They don't look for, or they don't understand sometimes what the qualification of the doctor was, what he has done, and it's very difficult also. How would any person know what I have done in Cambridge, or maybe in another country called London, or maybe what I have done in another training in my medical college? How would they know? It gets a little difficult. But then, as I was telling, the word of mouth will have a lot of value there, and they have to identify the right person. And of course, we telling the patient that what we do, and patients these days, they are doing a lot of research before they are coming to the doctor. That is a good sign. But then a referral system should also be developed in India, which unfortunately is not there. If you go to UK or any other Western country, you have a primary care physician, a general physician, what they call GPs. GPs are there in the community. They are aware which doctor to send this patient to get the best benefit. Unfortunately, we don't have that system. Directly the patient will book the appointment with a super specialist. I have a back pain for 2 days, 3 days. I was lifting weight. Now I can afford, so I'll go and see the neurosurgeon. So that doesn't work. Suddenly the neurosurgeon will look at it from the surgical perspective. He will offer you the surgery. Then he will start to get confused. Oh, I have pain for 3 days. Why is he offering me a surgery? I had my MRI scan. Then he'll take the MRI scan and he'll go to the next door to another neurosurgeon or to the next hospital. He will say probably you don't need a surgery. Then the patient will get confused. So how now? Then they come to another doctor who is known to them. Then he say, I don't understand, I'll send you to another doctor. So this is how the revolving door happens. So rather doing that, I would suggest patients to go to the general physician first, get an opinion from them, and then escalate it to the next level. And when it comes to the surgery, keep it as the last option. When it is an inevitable thing and you have a definite role for a surgery, find out from there, take a second opinion when the surgery has to happen, and then take a step forward. Just don't go blindly, at least in India. That's what, as of now, what I can suggest.
Thank you so much for your advice, sir. And you truly are a treasure trove of knowledge. We are very happy to have you with us today, and we wish you a very happy Doctor's Day.
Thank you very much. Thanks, Vinil, and
Thank
thanks
you, sir.
HMTV for having me.
Thank you,
Very
sir.
much. Thanks, viewers.